Nashville Cares has been serving Middle Tennessee with dignity and respect for over 35 years. We serve more than 60,000 people living with HIV or at risk of HIV. Our mission is to end the HIV epidemic in Middle Tennessee, and we work to achieve this through prevention, education, advocacy, and support. Our vision is to have a community where infections are rare, but when they do occur, everyone with HIV has access to care, treatment, and support to achieve optimal health and self-sufficiency without stigma or discrimination. At Nashville Cares, we support the whole person in a culturally competent, inclusive environment while alleviating barriers and ensuring effective linkage to care. For those living with HIV, Nashville Cares provides comprehensive medical and supportive services, including patient navigation, case management, transportation, housing, health benefit navigation, and enrollment, evidence-based risk reduction interventions, prevention and education, food and nutrition support, housing, behavioral health services for mental health and substance use, and policy and legislation advocacy. And of course, our new My House Clinic. Our My House Clinic is designed to be a one-stop shop providing medical and supportive services to meet the needs of same-gender loving folk and same-gender loving folk of color in Nashville, all under one roof. The clinic provides integrated HIV and STI testing and also screening, and has medical staff, which includes a nurse practitioner who's specialized in HIV, a medical director, a medical assistant, and a patient ambassador to support clients through the on-site and same-day lab and pharmacy resources. We offer pre-exposure prophylaxis, post-exposure prophylaxis, and rapid antiretroviral therapy, HIV and primary medical care, as well as gender-affirming hormone replacement therapy, which makes us the only local community-based HIV organization that provides this broad range and rapid start of services with the potential to address the HIV epidemic in the Nashville area. As such, Nashville Cares has received local and national attention for the development and implementation of the My House Clinic. The focus of our My House Clinic is to bridge the gap between community and clinic-based services, particularly for African Americans who are disproportionately affected with HIV. There are 4 pillars of our comprehensive HIV prevention core initiatives. First, we must diagnose and identify the barriers such as stigma, fear, mental health, substance use, lack of knowledge, lack of social support, and lack of testing in high-risk communities. Our approach is to provide comprehensive one-stop shop testing and screening by using on-site services or a mobile unit or an at-home and community-based testing. We will also be providing personalized cognitive testing to those who regularly get tested. Then we will treat by alleviating the barriers, expanding linkage to care, re-engaging those who have fallen out of care, ensuring medication adherence, and providing prevention and essential support and partner service referrals. In our Test to Treat initiative, via rapid initiation of HIV care, we promote the start of antiretrovirals within a few hours to a few days of new diagnosis or care re-engagement. Rapid initiation is 96% effective in reducing HIV transmission. Our My House Clinic is equipped with a full medical staff and an on-site laboratory, enabling us to provide rapid point-of-care treatment for all individuals newly diagnosed with HIV. In order to reduce barriers such as stigma, denial, substance use, lack of health insurance, and transportation, we initiated Rapid Start, have expanded clinical hours, provide peer and health navigators, and will be launching a mobile medical clinic. We also use Stay Connected intervention and early intervention services and behavioral health counseling. To prevent the spread of HIV among our target community, we must enhance and expand services for African Americans and others at risk. We provide referrals for PrEP and MPEP, condom distribution, prevention and essential support services, and risk reduction and behavioral interventions. By utilizing prevention education, Defend Yourself D-Up, on-demand testing, and the My House mobile application that has geo-tracking for advertising and social engagement, we can reduce barriers such as a fear of disclosing HIV status to partners and unknown HIV status, especially for those meeting online. Additional innovative strategies like social network strategy are Johnny-on-the-spot condom delivery and Test Sticks and Chill for on-demand testing, along with virtual NPEP and PrEP assessments for referral to patient navigator to meet those at risk where they are and encourage them to engage in prevention services and behaviors. In order to respond quickly to reduce HIV clusters, identify hotspots throughout the community, and improve outcomes along the HIV continuum of care, including achieving viral suppression, we will work with the state and local health departments and other service providers. We refer all individuals diagnosed with HIV for partner services and have ongoing partner relationships with local and state agencies. This comprehensive HIV prevention initiative to diagnose, treat, prevent, and respond addresses all barriers people living with HIV and those at risk experience and makes it possible to move the needle in ending the HIV epidemic in Middle Tennessee. The entire Nashville Care staff brings a wealth of knowledge and experience in HIV testing, prevention, clinical services, counseling, case management, behavioral health, and supportive services. Using innovative and cutting-edge approaches and strategies, this integrated, multidisciplinary, culturally competent, passionate team is committed to serving the HIV community in Middle Tennessee. Nashville Cares intends to respond to HIV diagnoses quickly, reduce new infections, increase access and linkage to care, and optimize treatment for people with HIV. We aim to focus this high-impact prevention initiative to reduce HIV health disparities among the same gender-loving community and the same gender-loving community of color, who are most vulnerable for HIV transmission in the greater Nashville area.